When medicines don't work, what do you do about treatment-resistant high blood pressure? Tampa General Hospital is enrolling patients right now in a clinical trial of a 30-minute minimally invasive procedure. Here's what it's supposed to do and who it may help. 62-year-old Dottie Flacco came all the way from Cocoa, Florida, for a chance at getting her high blood pressure under control.
I've struggled with this problem for over 20 years. 5 medications a day, twice a day. And that's a lot of expense, and a lot of them only work for a short duration.
Dottie suffers from what's called treatment-resistant hypertension. At times, her blood pressure was as high as 220/113. Hypertension is a risk factor for coronary heart disease, stroke, congestive heart failure, renal disease, and vascular disease. She's here in Tampa to be the first in Florida to receive a procedure at TGH in a randomized trial. Now, the goal of this trial is to prove a new minimally invasive catheter procedure will provide safe and long-term blood pressure reduction.
This is the hardest part of the procedure.
But in the cath lab, doctors ran into the unexpected.
Typically, the access from the groin to get to the kidney arteries is a pretty routine thing. Her blood pressure at the time of the procedure was about 250/110, which is morbidly high. There was some difficulty with her access of her artery, and ultimately she had a dissection of her iliac artery on the way to the aorta. That necessitated us stenting that artery.
They say the placing of the stent excluded her from the clinical trial.
If you're warming up for a basketball game and you're stretching and you pull a hamstring and they're in warm-ups, it's kind of unfortunate for her and for us.
While it didn't work for Dottie this time, the trial will go on, and TGH is still enrolling patients. The doctor says it's exciting for those who suffer from hypertension. They can't get under control.
Patients who are hypertensive know when they're on a good deal of medicine, it limits their lifestyle in many different ways, their side effects. So we hope that this technique will be proven to be valuable, and it'll be proven to be added to the armamentarium to fight hypertension.
And we checked on Dottie, and she's in good condition tonight. By the way, if the procedure is approved by the FDA once the trial is over, she could be a candidate to try again. If you'd like information on how you can enroll, go to my Facebook fan page. Just look for Linda Hurtado, WFTS, under Pages, and click like.